Hi everyone, Dr. Remy from Pain Free and Fit, and today we're going to be going over a great exercise for those of you with degenerative disc disease on how to integrate your multifidus stability of your lower back with your hip stability. Hope you enjoy. So remember, with degenerative disc disease of the lower back, many times in chronic pain, the multifidus muscles, which are those small muscles that run from the sides of our vertebra bones, right in the midline of our spine, down and outwards, become weak. In fact, many times within hours of lower back pain episode, the multifidus starts to become inhibited. Within days, it starts to become atrophied, and in many long-term cases, these essential stabilizing muscles become weak. Also associated with degenerative disc disease often is a weakness in the buttock muscles, where through postural and neurological changes, the buttocks become weak, the lower back and the hamstring muscles overwork, and as you bend, as you lift, as you turn, walk, step, the buttock muscles are being underutilized, and the larger muscles of the lower back, like the erector spinae, have an overcompressive effect on the spine, and this can aggravate our pain. So this exercise integrates multifidus function and glute as well as psoas hip flexor function to help stabilize both the hip joint and the lower back area, many times training and conditioning your body to relieve itself of the pain associated with walking, climbing, bending, stooping, and bending. So to do this, we're going to figure out if we have a weak multifidus or glute muscle. We have other videos that demonstrate that. But if you have a weakness in your multifidus muscle, I want you to go to the side of the multifidus, that's weak, put your finger on it. Normally when you pull your lower abdomen in or cough, you'll feel that multifidus activate. It'll bulge out from the bottom corner on both sides of each spinal bone in your lower back. Monitor that with your thumb and place that weak multifidus upwards as you lay on your side. Your top leg can be bent off towards the front, and many times that side where the multifidus is weak, you'll also have a weakness in the gluteal muscle and a weakness in the psoas, which is a muscle that runs from the front of our spine down into our hip joint that helps to stabilize the hip. And what we're going to do in this exercise is very simple. We're going to try to shorten the leg bone back into the hip socket. We're going to try to pull the knee straight up the thigh into the hip. And as you do that, you'll start to feel the multifidus that's weak start to bulge into your finger. Hold that tension and then slowly release it. I'm going to hold it for about 5 to 15 seconds. Again, let your leg fall down, knee towards the floor if you want. You don't have to be laying on an exercise bench. And just pull that leg upwards back into the socket. If you keep some of your other fingers besides your thumb that's on your multifidus on the buttock, you'll notice that as you pull the leg back into the socket, the psoas, which is in the middle of the groin, will start to tighten. The buttock will tighten as they help to shift the hip back into the socket, and the multifidus will tighten at the same time. So this is a great one you can do for repetitions, starting with 3 or 4 repetitions and building up to 12 to 20. It's a great way to start to wake up neurologically both the buttock muscle, the multifidus, and the psoas to stabilize your lower back and hip complex before you go and do any bending or lifting. You can do this to both sides. You can do this at several segments in your spine. If you have multifidus weakness at, let's say, one area or one knob or spinous process bone in the low back, you can try some there. You can go down to the other ones that are involved. You can do that to both sides. Try to end your session with these exercises so that the leg that usually externally rotates, which is the side of the greater glute or buttock weakness, is positioned upwards last. That way you're going to finish off in a corrective direction for your unique mechanical and posture problems. If you're looking for a great personalized custom exercise routine that'll help you with your degenerative disc disease, go to our painfreeandfit.com website. We've got a great fast track healing exercise program for degenerative disc that goes over pain relief exercises, corrections in terms of conditioning and stability issues, shows you stretches, we have nutrition there, a whole program designed around a unique analysis of your lower back issues that helps you condition your lower back to prevent pain. I hope this series on multifidus and hip stability helps with your degenerative disc disease.